Ampicillin is a medication that is used often in the hospital, and we're going to talk about what it is and how we use it. So the trade name is Principen, generic name Ampicillin. Its action is it's bactericidal. So what does that mean, bactericidal? That really just means that it kills the bacteria, right? It's broader spectrum than penicillin and some other cillins. And what it does is it binds to the cell wall, leading to this bacterial cell death. So by binding to that cell wall, it actually kills the bacteria. So indications for use are skin infections, soft tissue infections, respiratory infections, GU infections, meningitis, septicemia. So it has, like we said there, it has a very broad spectrum of bacteria that it can actually kill. Also used often in otitis media and sinusitis. So these sinus infections it can be used for. So if you have somebody come in, you're not really sure what's going on, not really sure what type of bacteria we're dealing with, we can give like an ampicillin, which is a broad spectrum, just simply meaning it can attack and it can work on many different kinds of bacteria. Okay, so therapeutic class is anti-infective, pharmacologic class, Aminopenicillin. And again, with these cillins, when you hear that cillin word, that cillin suffix, you're thinking penicillin. And the first thing that triggers off in your mind is you're thinking penicillin allergy. I need to assess for that. I need to watch for that. I need to make sure my patient has never had any sort of reaction to any sort of penicillin. So obviously, contraindicated in penicillin allergy, assess your patient, check in the MAR. If there is any sort of reaction, then you need to document that and make sure you let the patient know what happened and what they need to do. Even the slightest reaction at any point in their life, they need to let people know, well, I had a slight reaction at some point to a cillin, okay? You need to use caution with renal insufficiency. These are excreted by the kidneys. They can be damaging to kidneys. This also can cause seizures, diarrhea, anaphylaxis, and superinfection. What's a superinfection? What happens is we throw these broad spectrum antibiotics at people, and the bacteria actually becomes stronger. It doesn't kill them off, it can actually become stronger. That's a superinfection. The way that we can notice that and what you want to teach your patient on how to identify that would be furry overgrowth on the tongue, vaginal itching, loose and foul smelling stool. So these can lead to like C. diff, okay? And if you've smelled C. diff, if you've ever been in a patient's room with C. diff, you will never forget that smell. And you can even just walk into a room and be like, well, we got to do a culture for C. diff, okay? We got to check for that. So this can cause this diarrhea, it can cause this superinfection, and we'll be able to recognize that. So we're going to assess our infection, make sure infection's getting better. If we're giving it for otitis media, we want to make sure the ear infection is improving and that we're getting better, right? That's what our whole goal is here. One big thing with this too is you want to let the patient know that they should not use with oral contraceptives, okay? So contraindicated with oral contraceptive use, and we're going to monitor liver function tests as well. So kind of a very broad spectrum, as we said. It has a huge, from skin infections to septicemia, meningitis, just a huge GU infections. It has a huge range of things that it can be given for. Penicillin allergy is a big thing we're going to watch out for. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.